Welcome back. You're still watching The Globe. The United Nations Children's Fund has called on world leaders to revive efforts to reach targets set out in the political declaration. It's found that children living with HIV are facing difficulties in accessing HIV-related health services. UNICEF launched its 2021 HIV and AIDS Global Snapshot.
UNICEF has called on governments to do more to ensure children and adolescents have access to health services. While progress has been made towards increasing access to HIV-related services for adults, 85% of women now have access to life-saving treatment like ARV medication compared to 25 years ago. But children and adolescents aged 10 to 19 remain marginalized. According to UNICEF, 15% of children living with HIV/AIDS died last year due to a lack of access to treatment.
Our recommendation is that children that are exposed to HIV because their parents are living with HIV should be tested at about 6 to 8 weeks. Then when they come in for their immunization. We saw declines in that, and then because of that, we also saw major declines in access to treatment. And we know for kids this is not anywhere acceptable, because we know 30% of children, if they're not treated early enough, will die by year 1, and 50% will die by year 2.
UNICEF also noted the interruption to HIV-related services during the coronavirus pandemic. Access to treatment was compromised, fewer tests and medical male circumcisions were carried out during the various lockdowns.
We have the communication links with populations living with HIV. They were able to organize themselves very quickly around messaging, around supporting each other to make sure that the access issue was dealt with. We're able to communicate with them on SMS platforms to make sure that we're getting them the information that they need, and also to make sure that within the national responses, the people living with HIV were also included.
So far, only Eswatini has reached the benchmark to provide 85% of children with treatment. Balentle Mthethwa, SABC News, Johannesburg.
Joining us now via Zoom is Dr. Shaffiq Essajee, who's the Deputy Chief of UNICEF's Global HIV/AIDS programs. He is a clinician, scientist and public health specialist who's been caring for children with HIV in New York and his native Kenya for over 20 years now. Dr. Essajee previously served as a medical officer for the World Health Organization in Geneva, specialising in the prevention and treatment of children with HIV. And before that, he was senior medical advisor to the Clinton Health Access Initiative, where he led the organization's innovative paediatric treatment program. All right, he joins us now. Dr. Essajee, thanks very much indeed for joining us. I'm alarmed by this statistic. A child was infected with HIV every 2 minutes during 2020. This is pandemic.
It is indeed a pandemic, and a pandemic that we've been living with for the last 30 years. Peter, it's important to put that number into a context. It was much, much worse 10 or 15 years ago. At the height of the pediatric HIV epidemic, we were seeing close to 500,000 new HIV infections in infants every single year. And that number is now down to about 160,000, we estimate. So there has been significant progress, but you cannot escape the fact that, as you said, every day, every minute, we see children, we see adolescents that are still being exposed to, being infected by HIV, despite all the services that we have in place and the knowledge that we have to prevent this infection from taking place.
All right. And so that's a problem that we've had a long time improving. What has COVID-19 done to that?
That's a very good question, and to be completely honest with you, we don't really know. we do know for a fact that at the worst times of the lockdown, children were not accessing testing and treatment. Mothers were not attending hospitals for deliveries and therefore not getting tested for HIV and not receiving the care they need to prevent transmission to their babies. The impact of that, I think, is yet to be fully understood and felt, but we can certainly be certain that there will be, as a result of that, more infections among children, and there will be increases in resistance to HIV medicines, potential death, and certainly worse disease from HIV because people weren't able to get their treatment for long periods of time. So I think it's still a story that's evolving, and it really teaches us that we have to learn how to make systems for treating kids with HIV, treating mothers with HIV, much more resilient to the sorts of shocks that the COVID pandemic has brought than we have been to date.
I would imagine, especially when I consider our continent, Africa, and other developing nations, that our healthcare system is already under huge strain. And for them to have a pandemic, that means the HIV and other illnesses almost get pushed out of the door.
Certainly the case. It's very hard to draw attention to a problem like HIV, which we've been dealing with for a long time and which in the public's perception is something that is sort of under control when there's such a looming problem before us. But I think what's important to recognize is to see the connections between these two conditions. Both are pandemics, both have been with us now for years, going into the third year of the COVID pandemic. And the systems that we need to address both of these, providing information, providing prevention, and providing access to treatment when you need it, are very similar. So in a sense, the message that we need to be reinforcing here is that let's strengthen our health systems. Let's learn from what we've done well with HIV over the past decades. Let's understand from where we failed with COVID to better improve the health service and put in place the sorts of systems and innovations that we've seen that can really help to make a difference for the future. Things like getting the community involved, bringing people that are actually affected with these conditions into the service provision system so that we're harnessing their power and their energy to spread accurate information, to provide access to prevention and treatment services, to make sure that people are getting tested when they need to get tested, and using smarter technologies to keep those connections between communities and their providers vibrant and alive, even if they can't see each other in person.
The other challenge, I guess, as well is as you talk about messaging and trying to get people to know and think differently, I also read that 2 in 5 children are living with HIV and don't know their status. So now there's this thing of you're scared to go to a hospital because COVID-19, you're scared to get tested, COVID-19, and yet you should be testing as well for HIV. Should we be doing these tests at the same time?
Why not? Why not? We've actually been advocating for this for a long time, and especially because we know that people living with HIV, if they are not diagnosed and if they're not on treatment, are going to be immunocompromised, and that will impact their ability to not only defend themselves against COVID, but ensure that they have a good outcome if they do develop COVID. So the immunosuppression that HIV causes can directly influence an individual's response to coronavirus and how they are impacted by the disease. So we should absolutely be using this opportunity to recognize those that are immunocompromised, to prioritize them for vaccination, and to make sure that they're getting access to the treatments that they need to maintain their body's immune function in order to optimize their ability to defend themselves against coronavirus. The diseases are linked, and the testing is very simple for both illnesses, and we should absolutely be linking these testing strategies, especially in countries where there's a high burden of both conditions.
At the beginning of this conversation, you talked about the disruption, particularly during the hard lockdown. We haven't had many sort of massive lockdowns for a while now. Have you seen an improvement in access to HIV and AIDS treatment, or is there been a slow recovery?
There's definitely been a recovery. It's been not as rapid as we would have hoped. If you compare the numbers that countries are reporting this year compared to where they were at in 2019, pre-pandemic years, there's been a small but significant decline in terms of access. So we're not back up to the levels that we were functioning at. What concerns me, though, is that, now we're talking about Omicron. There will be other variants, and there will potentially be future lockdowns and reasons to be, again, scared of going to hospitals. How situations. And what do we have in place to make sure that we don't see a repeat of what happened in 2020? I think those are the challenges that we have to address and talk about together.
All right, Dr. Essajee, we're going to have to leave it there. I wish we could have talked a little bit longer about this, but thanks so much indeed. And let's just hope that we can mobilize and especially deal with the inequality of all of this. But thanks for your time.
Thank you very much.